I got goddamn shingles. Hey everybody, Lindsay here, aka the Crohn's Ranger, and today on Crohn's Chat we are talking all about skin issues. The topic of this video is something that I've had to deal with very recently. Those of you who follow me on Facebook and Twitter know that I got the shingles. The fucking shingles. I've never had shingles in my life, but I got shingles. Now they say it's related to the chickenpox virus, which I had really bad when I was a kid. Really bad. I was talking to my brother about it and he said my whole back was like one giant chicken pox. But no, I had the shingles. They were on my lower leg, but I also had some on my face. Now this is acne. But I had a spot right here and I had a spot on my eyelid that was shingles, which was a little unnerving because if you get shingles around your eye, you can go blind from it. But luckily, it was just the one and it was a little above where my eye socket sits, so it wasn't quite completely on my eye, but it made me have really bad headaches. It made this lymph node right here swell up and get all gross and kind of like had this puffy effect on my face, and I had terrible headaches on this side of my head, all from shingles. When I first saw it, I thought it was bug bites, but I went to the doctor and he's like, nope, it's the shingles. But just in case it isn't, since you're on an immunosuppressant, we're gonna fight this both ways. We're gonna give you antibiotics and we're gonna give you the viral treatment. So I got to take 2 huge fucking pills for a week straight, and luckily the shingles started to subside, they started to fade, they started to scab over, and they're pretty much gone now. There's a little discoloration still where they were, but I'm not having any pain from them. All the symptoms have gone. But you know what? It really fucking sucked having shingles. Goddamn shingles. I thought only like 70-year-olds got shingles. Nope. I got shingles. Crohn's disease has many secondary symptoms outside of the digestive system. These symptoms are called extraintestinal. And the number 2 extraintestinal complication behind arthritis is skin problems. There are very few, if perhaps none, other cronies and people out there with colitis, IBD in general, who have not had any kind of skin issue to go along with their disease. One big skin issue that's directly related to Crohn's disease, because it is also an autoimmune disorder, is psoriasis. Some of the medications even overlap. Things like Humira and Remicade, those are also used for psoriasis treatment. There are 3 big skin issues that you can have that are directly related to Crohn's disease and other IBD issues. The big one, the one that I've experienced the most, and the one that I've seen to be most prevalent among IBDers that I know, is erythema nodosum. The way erythema nodosum presents itself, it's these red bumps just underneath the skin. They usually happen on the lower leg and shins, but I've had them on my hands, I've had them on my elbows, and around my knees. And erythema nodosum is especially prevalent in women with IBD. The thing that sucks about having this erythema nodosum is, 1, it's very unsightly, especially in the summer when you want to wear shorts and stuff like that and your legs just look atrocious. But they also hurt really bad. There's almost like this intense pressure behind these sores where you think they're just gonna pop open one of these days, can make it difficult to stand, and can really interfere with your day-to-day activities. And there's really no treatment for them either. I mean, you can wear compression stockings, you can elevate your legs, but really you just kind of have to let them run their course. Usually when I got them was when I was right in the midst of a really bad flare. I had them the worst when I first got sick, and then right before I had my ostomy surgery. For me, they usually accompanied very severe weight loss. The second skin condition that can happen is pyoderma gangrenosum. These are a little more hardcore than erythema nodosum. These are actually pus-filled sores that can burst open and drain. The blisters are usually very red or purple and can look very infected, but antibiotics do not treat them. What is used to treat them is usually a super high dose of steroids. Third condition is aphthous stomatitis. I think I'm pronouncing that right. And this I've also had, although I never realized it actually had a name. And these are ulcers that happen in your mouth, on your gums. And again, these pop up whenever symptoms are really flaring. It really hurts, it's really sensitive, it makes it very, very hard to eat. I mean, when I had them for probably 6 months, and I was in agony all the time. They usually form between your gums and your lower lips. I had them on both sides of my mouth, between my back teeth and my cheek, and my face would get swollen, and it made it very, very hard to eat anything. They're pretty much canker sores on steroids. Of course, there's always the run-of-the-mill skin issues that most people with Crohn's have. Because we use the bathroom so often, skin can get raw and red and painful. We can get tearing and fissures and all of that kind of stuff. Also skin tags. And if you have a fistula, the skin around that area can get very, very inflamed and very, very sore and very painful. There are some other more rare skin conditions that can happen related to Crohn's. Most of them are due to things like vitamin deficiency. One of them is acrodermatitis enteropathica, and this is caused by zinc deficiency. This presents itself as like a pink scaly rash around the mouth or your bottom. And what makes it go away is getting some zinc supplements and getting that built back up into your system. And that can be extremely difficult for someone with Crohn's, because if you're constantly going to the bathroom or if you have an ostomy and you're dumping, it's gonna be hard to keep those nutritional levels where they should be. Another one that is rare, and I'm gonna have to read this directly off of my phone because it's super hard to pronounce, it very long, and it is epidermolysis bullosa acquisita. Yikes. This usually pops up with people who have had Crohn's for a very, very long time. It presents as blisters on the knees, elbows, and feet. And again, the only treatment is immunosuppressants or really, really hardcore steroids. Getting into more of the skin issues that I've dealt with personally, the one that is painfully obvious is acne. Crohn's disease can cause acne. Anytime there's inflammation on your body, including your skin, your Crohn's disease can affect that. I usually break out when my symptoms are worse, and since I'm on immunosuppressants, once a breakout starts, it is incredibly hard to get rid of. I've been fighting this breakout, I think, since mid-October of last year, and it's shockingly gotten better. It was even worse than this if you look back in some of my other videos, and I posted some pictures on Twitter. I mean, I just had monster zits, huge whiteheads, and no matter how, I was washing my face every day and it didn't help. I was conscious of not touching my face and that didn't matter. I even started cutting out more fatty foods from my diet, and even that didn't help. And so far the only thing I found that helps is just a regular skincare routine and moisturizing. Because earlier what I was doing was I was just trying to scrape my face raw pretty much, and it would get dried out, and then those would get infected and cause other breakouts, and it was just a never-ending cycle. But it's very hard to be patient when you want your skin to clear up. And I'm trying to be patient now for about 6 months. So hopefully this will go away soon. I can only hope. Another thing that's very important about your skin for those that have Crohn's and colitis, if you are on any kind of immunosuppressant, especially biologics, it is very important to get a cancer screening once a year. Those of us that are on those medications, our risk for skin cancer and other cancers is even higher than the general population. So make sure you pay attention to your skin, how it's changing. Go to a dermatologist, get a mole check every year. It's very important. The sooner you catch something, the better off you're gonna be. What I hope you'll take away from this video is that our skin is the largest organ of our body. We need to take care of it just like we try to take care of our digestive system, because it's a symbiotic relationship. One feeds off the other. If one part of your body isn't functioning properly, other parts of your body aren't going to function properly. And also those of us with ostomies and ileostomies, we have an even different set of rules when it comes to skincare around our stomas, because we're constantly fighting with adhesive and making sure the area around the stoma stays clean, doesn't get dried out, doesn't get too wet. Skin can start to break down. There are a huge host of skin issues that can come along with having an ostomy. So it is very important, if your skin is starting to break down around your stoma, if there's any color changes, if there's anything that's painful, uncomfortable, or just doesn't look right, call your doctor, call your stoma nurse, get it checked out. Don't try to fix it on your own. Don't just try to wait it out. I did that once and I ended up with an abscess right next to my stoma. It's not fun. They had to stick a needle in there and pull all the gook out. Yeah. That's gonna do it for this Crohn's chat. My name's Lindsay, aka the Crohn's Ranger. I love you. Bye.